Researchers at the Baylor School Lab in Chattanooga say they've identified a new strain of coronavirus in 2 people from our area. We'll go live now to Channel 3's Joy Dukes at Baylor with more on what this means and how they were able to detect it. Joy?
Yeah, David, this new strain of the virus has been, as you said, detected in 2 local people, and I'm told researchers are waiting on confirmation in a 3rd sample. Right now, they do believe that this is the same version of the virus that was identified in the UK earlier last year. And right now, if that's the case, it would be the first report of that new variant in the state of Tennessee. To the untrained eye, this may look like no more than lines on a piece of paper.
The assay that we've chosen to use has 3 different viral targets.
But for Baylor School Lab researchers, this data plot used to detect the coronavirus in test samples
We've now processed thousands and thousands of samples.
Was the first clue.
On December 8th, we came across a very unusual profile.
That a new, more contagious version of the virus is now present in the Tennessee Valley.
And the longer that a virus is out in the population, kind of circulating and replicating, the more likely there is to be mutations that are acquired. And some of those mutations are going to be advantageous for the virus.
Dr. Dawn Richards and Dr. Elizabeth Forrester tell Channel 3 they believe the variant they discovered is the same strain UK officials identified in mid-December.
We noticed it, we reran the sample and confirmed the PCR.
Weeks before the variant was formally identified in the U.S.
We didn't do anything with that information at that point. It was just an observation. And when we saw the same amplification curve in a different patient, that's when it kind of perked our ears up a little bit.
While the new, more transmissible strain does not cause more aggressive symptoms, Forrester says it's still an alarming development, with coronavirus cases continuing to climb in Hamilton County.
The fact that more people can become infected, then that increases the number of deaths and severe cases that we see. And right now our hospitals really just need our help.
She and Richard say because of the new strain, it's now more important than ever for residents to continue wearing masks, avoiding gatherings, and maintaining their distance. And researchers have, as I said, sent that 3rd sample off to the State Department of Health, and from there it will go to the CDC for sequencing to confirm that it is in fact the same variant that was identified in the UK and other parts of the U.S., including Georgia on Tuesday. Reporting live in Chattanooga, Joy Dukes, Channel 3 Eyewitness News.